Health Minister, MECs and experts have often talked about infection peaks, but what exactly does it mean? Well, the National Institute for Communicable Diseases, Professor Adrian Puren, will hopefully shed some light on that for us this morning. Adrian, a very good morning to you. And yes, we hear about the peak and the peaks that are to come. And I suppose let's just ask the obvious question is, are we at the peak at the moment? Is this it, or is it still coming?
No, I think the peak, which is really described as the maximum number of cases that we'll observe, has still not been reached. I think in the Western Cape there are some hints that may be the case, but I think we'll still have to wait and see perhaps over the next 2 or 3 weeks with regard to the Western Cape. And then the other provinces will certainly follow, or within particular provinces, we'll certainly see a maximum number of cases that have been reached. But that by no means is the end of it, I'm afraid. We will continue to see transmission occurring, and so there will be what's called a flattening, if you like, and that's what we've always been speaking about, the flattening of the curve, and that can continue for a while as long as there are cases, susceptible cases, for transmission to occur. So I know we talk about waves as well, and again, I think there's a great discussion about whether we can actually talk about waves with regard to this particular pandemic. So classically, when you look at flu, we see a peak of cases and then a decline, and it, if you like, disappears and then reappears in the following autumn and winter. But it's not clear that with regard to this particular epidemic and this particular virus, that in fact we'll see similar behavior. In fact, it's unlikely when you look at what's happening in the Northern Hemisphere. If you look at the United States or the UK, you're still seeing, despite an initial peak, as it's called, and they thought there were declines. In fact, we've seen resurgences as those societies have actually opened up.
All right. So, from what you say, I gather that we should expect that different provinces would peak at different times, and then do we eventually look at a countrywide picture, a national picture? Absolutely.
So what we'll see is different times of the so-called peaks, and then declines of cases, but these will not necessarily disappear. As I said, we're still in the phase where we don't have a vaccine, for example. We still have a large number of susceptible individuals. So we will see ongoing transmission occurring. But what we would like to see, hopefully, is also as the numbers of cases decline, is a decrease in mortality. And that will be a key indicator that in fact, transmission rates will have declined. But I'm afraid it's going to continue. And so the key things still remain are those key and core messages that we keep on saying every day. It's in your hands. We have to be responsible. So physical distancing, the wearing of masks, the cleaning of surfaces, good policies in place to ensure the shielding of, in particular, the older age groups and those individuals with comorbidity. So those events still have to occur until such time as we have an antiretrovirals, for example, or medications that work to control replication of this particular virus, and or the presence of a vaccine. I'm afraid this is going to be ongoing.
So, Adrian, we seem to be pinning our hopes on the warmer weather when we finally have our summer here, because this virus barely survives in very warm weather, we're told. So are we just a bit misguided there? Do we see, is that something that we shouldn't put, pin all our hopes on that?
Yeah, I would not do that. I think that this virus behaves very differently. I know with flu, for example, we know that the colder weather, for example, the dry air, certainly allows for greater transmission, and that's why we see the peaks in winter. And as the summer weather arrives, it gets warmer, greater humidity, and the virus, if you like, is suppressed. This particular virus appears not to behave in that particular way. I know we're seeing declines in cases, but you can see what's happening in the United States and other places which are experiencing their spring, summer weather. So the behavior is somewhat different. So I don't think we can pin our hopes on that.
Okay, sneaky virus that it is. Thanks very much, Adrian Puren there from the NICD. So a better idea of what a peak is. There's no one block of peaking. It's going to be different provinces and then hopefully eventually a national picture. But we won't be out of the woods for a very, very long time.